Kate Tulenko. She is the founder and CEO of Corvus Health. Kate, thanks very much. Always a pleasure to see you.
Absolutely.
There are a lot of people sort of scratching their heads about President Biden's comments. Look, everybody wants this gone. But even if it has moved from a pandemic to an endemic, as Ed has pointed out, there's still 500 people dying daily in the U.S. And from what I just read, that is the third leading cause of death in the United States. What are the dangers about possibly downplaying this?
Well, the danger is that people will change their behavior and engage in high-risk behaviors, such as, going to crowded concerts or other crowded venues without a mask, not social distancing, not practicing the proper hand hygiene, and that we might see a spike in cases, more people hospitalized, the hospitals more burdened so that everyone can't get the care that they need. So it is a real concern. And 500 people dying a day is much more than we see in the average flu season or even in a bad flu season.
Yeah. Now, long haulers, man, that is especially tough. Anyone, let alone people who are actually dealing with this, but anyone who spent time with someone suffering from this, the brain fog, the fatigue, any of the litany of ailments, what is the U.S. doing to perhaps develop better treatments, find ways of easing the suffering, or at least letting people know, yes, this is what you're going through?
Well, the U.S. is working on both research and care. On the care side, every state has at least one clinic that sees long COVID patients. And I would urge anyone who has long COVID or think they may have it to find that clinic and be seen in that clinic, because we're developing biomarkers to be able to diagnose what type of long COVID you have, and eventually we're developing treatments. On the research side, scientists are looking at, what's the mechanism of the long COVID, what are the different types of long COVID, and what are the biomarkers. The biomarkers are important because we need to tell, who actually has COVID and who is malingering, which is the medical term for faking your symptoms to avoid work or other responsibilities. And there have been several studies in the U.S. and elsewhere which have shown a distinct difference, a measurable difference between people with long COVID and people who've just had COVID or people who haven't had it at all. For example, one of the most common is elevations in D-dimer, which is a measure of clotting, and elevations in C-reactive protein, which is a measure of inflammation.
Okay, Kate, another aspect of the long haulers, millions of people, and from the research I looked into, it is millions who have not been able to return to the workforce due to the fatigue or not being able to concentrate on the phone or something like that. Is this something that you think people realize just how significant this is?
I don't think people do yet. And myself and many other physicians have been saying for a year or more that the biggest impact of COVID will actually be the long COVID, that we currently have about 4 million people unable to work, disabled enough that they can't work due to COVID. It's estimated there are about $170 billion a year in lost wages. So this will impact our country and the world for a decade or more to come. So it is quite significant. So just from the economic point of view, not to mention relieving people's pain and suffering, it's essential to find treatments.